No surprise, flu season is here, and that brings the question up of should you get the flu shot or not, and what are some of the benefits that go along with the flu shot. I want to introduce Dr. David Martin. He's an infectious disease specialist at Munson Medical Center, and I just want to thank you so much, Dr. Martin, for being here.
My pleasure.
And when you look at the flu, first of all, what is the flu? We always talk about it every year. What is it, and how easily is it transmitted?
I'm glad you asked that because I think there are some misconceptions about what is truly influenza as opposed to the common term we often use as flu.
Sure.
A lot of people think flu is when they get an upset stomach and nausea, vomiting, and diarrhea, and that really isn't truly influenza. Influenza is a virus which attacks the respiratory tract, and it causes a very severe illness, and it's highly contagious from person to person during the influenza season and can be deadly for a number of people in our population.
What about some of the signs and symptoms that people should look out for? You know, signs that maybe not everyone will get, but some of the bigger ones that really stand out.
Yeah. Well, when you get influenza, if you really get ill from the virus, it's likely to be a very severe illness. And usually it starts very abruptly. The incubation period is roughly 18 to 72 hours. So within a short time after coming in contact with somebody with influenza, if you get it yourself, you're going to come down with fevers, chills, sore throat, and then you begin to develop a cough. Usually the cough is a dry cough, non-productive, but it can be quite severe.
Okay.
And one of the things I always tell patients about is that one of the clues that it might be influenza is you get these terrible body aches. I always tell people, it feels like you've been run over by a bus.
Those aches are kind of that indicator something is not right.
Yep.
What are the best ways to prevent it? We hear so many times doctors recommending wash your hands, you know, keep proper hygiene.
Yeah, that's absolutely right. And hand washing is extremely important at all times of the year, but in particular during the influenza season. It is transmitted just through the air, through breathing, coughing, or sneezing.
Okay.
But it's also transmitted, we think, on the hands of people who might be infected. But probably the best thing you can do to prevent getting the flu is getting a flu shot. We really do think that's very vital.
And when it comes to the flu shot, who should be getting these? Who's most at risk and, you know, should be going to the doctor, the pharmacy to get the shot?
Well, that's interesting because it used to be in years past, we would say those people who are at high risk of getting the flu. But now what we know is that by getting the flu shot, you not only protect yourself, but you then will prevent yourself from carrying the flu virus and spreading it to others. So now the recommendation is everybody should get the flu shot, from infants all the way up to the very elderly.
Okay.
Whether they have underlying medical illnesses or not, we're trying to encourage everybody in our society to get a flu vaccine. Especially
if you're coming in contact with a lot of people. If you have a job where, you know, you're seeing people on a regular basis from all different, you know, walks of life where you can spread those germs.
Yep. And particularly, too, even if you just have friends or family that you don't want to give the flu virus to,
a good point.
It's responsible to go ahead and get the flu vaccine and protect them as well.
Well, Dr. David Martin, I want to thank you. Dr. Martin is an infectious disease specialist with Munson Medical Center. Definitely some very interesting points to keep in mind, especially this time of the year. And of course, I want to also mention, stay with us. We have part 2 of this interview coming up in just minutes. We're going to talk with a local pharmacist and have a couple people in studio actually get the flu shot on air. So stay with us. Dr. Martin, thank you so much.
My pleasure.
And taking a look at weather watchers this morning, we turn things over to Storm Team meteorologist Joe Charlevoix. Well, good Monday morning, Northern Michigan. We're talking about flu shots this morning, and Joe and Brody actually are ready to get some flu shots. That's why they're a little undressed here this morning. That explains that right there. So I'll explain that first. But I want to introduce Kathy Engstrom. She's a pharmacist, also manager for retail pharmacies at Munson Healthcare. So Kathy, thank you so much for joining us.
Oh, my pleasure. Thank you.
Before we give the guys their shots, I wanted to ask you a few questions about the flu vaccine. Where can people typically get the vaccine from?
Well, as you drive around town, you'll see signs everywhere these days, but at Munson we offer it at our urgent care over at the Munson Community Health Center.
Okay.
That's next to, it's where the old osteopathic hospital used to be. And we offer it up at Bayshore Pharmacy in Sutton's Bay, one of our pharmacies that actually offer it.
Typically, how much will the shot cost, and will some insurance companies cover it?
Yes. Most insurances actually cover it. For sure, Medicare covers it for no charge for people, and quite a few more insurances, very few don't cover it anymore. And if it is not covered and you want to pay for it, the price goes anywhere from we charge $25 up in Bayshore Pharmacy, and it can go up to like $45. It depends on where you go.
And people like Joe and Brody, after they do get the shot, will they have some symptoms or some, you know, they kind of feel a little under the weather after you get the flu shot?
Most people forget they have it. A couple of days later, they see something about a flu shot, and they'll be like, oh yeah, I got one. But a few people will the most common side effect would be redness or soreness at the site of injection.
Sure.
Sometimes there might be a little bit of like fever, malaise, muscle ache.
Okay.
All that's pretty rare.
What about crying on live television?
We're going to find out.
Well, I did bring an EpiPen just in case.
Okay, good.
There is one severe reaction that doesn't always happen.
Okay.
It's very rare, but people can have where their whole system shuts down and it's an emergency situation, an anaphylactic reaction.
I'm excited.
Well, Kathy, I'm going to let you take over then and actually administer the shot. So I'm going to scoot to the side here.
Okay.
And
just don't let Melissa do it.
No, I won't. I'll stay away.
All right.
But if you can just explain, Kathy, what you're doing as you're giving the shots.
Sure, sure. Well, first of all, Joe, are you allergic to eggs?
I am not, no.
Okay. Have you had a flu shot before?
I have, yeah.
Have you ever had any bad reaction?
Nope.
To any of them? Okay. And do you have a latex allergy?
No, I don't.
Okay.
I hope my doctor's watching. He'll be happy.
Yep. So those are all, questions that we would ask people before we give them. And which are
you want to do this one? Is that okay?
Whichever one works for you.
All right, this works.
I'm going to lean out of the shot here and let you go to work.
Okay.
And I should mention this too, because a lot of people, I'm also a diabetic.
Okay.
So I know it's really important for people who have diabetes to get flu shots.
Yes.
As well, so.
Yeah. As Dr. Martin said earlier today,
Get out of your way.
It's important for everybody.
Yeah.
We want everybody over 6 months old to receive the shot this time. So just relax.